Good afternoon, everybody. My name is Gabriela Contreras and my topic is diaphragm. Definition: the diaphragm is a dome-shaped sheet of muscle and tendon that serves as the main muscle of respiration and plays a vital role in the breathing process. Also known as a thoracic diaphragm, it serves as an important anatomical landmark that separates the thorax or chest from the abdomen.
The primary muscle of respiration is the diaphragm. The diaphragm is a thin, dome-shaped layer of muscle and tendon that separates the abdominal cavity from the chest cavity. It gains its shape from its attachments and from the organs that surround it, especially the heart, lungs, and liver. The diaphragm attaches at the costals along the lower rib cage, high in the front at the sternum, and deeply in the back along the spine. The diaphragm also attaches to itself via a central tendon, making the diaphragm one of the unique muscles of the body. The diaphragm uses its central tendon and its attachments as leverage to flatten during inhalation. The expansion of the ribs comes from the resistance of the internal organs to downward movement. As the internal organs are slow to move, the ribs expand to make room for the lungs. While the diaphragm attaches at the bottom of the ribs, its range of motion never reaches that low in the body. As seen from below, we get a sense of the full range of motion of the diaphragm as it would glide over the aorta, the vena cava, the esophagus, and the internal organs. For more information, visit www.3dyoga.com.
Application in medicine. A treatment for paralysis of the diaphragm is a surgery, rebuilding the phrenic nerve neurolysis, that it is surgical release of inflammatory adhesions, or with a nerve graft and neurotization when nerve damage was more extensive. Advantages. It is also one of the most important muscles for proper execution of singing and wind instruments.
I'm sure you can see on this picture of the diaphragm that there's a slightly darker line which is just underneath the rib cage. This is the diaphragm, and it's actually as thick as a piece of car tire. Now when you breathe in, you may be able to see that there's a couple of little arrows going in either via the nose or via the mouth. The lungs fill with air and the diaphragm drops down. In the diagram here it says the diaphragm contracts, but I prefer to use the word the diaphragm drops down because it's a kind of easier way to think about it. So the diaphragm drops down, and then as you breathe out, either on a psh or a or whatever sound you're using to actually make a pronounced breath out, you will see that the diaphragm slightly moves up again. It says here the diaphragm relaxes. It actually kind of goes back to its original position. And you can see this on the diagram on the right-hand side where it says breathing out. And again, if you follow those little arrows, the air comes up via the windpipe and either goes out via the nose or out via the mouth. Again, I just want to draw your attention to the fact that when you're breathing in, the chest ever so slightly expands, and when you breathe out, the chest actually contracts a little bit as the diaphragm moves upwards. So there is a little bit of movement in the upper body as well, but you really need to be concentrating on the lower abdominal wall to really get the best optimum breathing. I think it's very interesting to note that the diaphragm goes down lower at the back than it does at the front. And we're going to try a couple of exercises in a moment where you'll be able to actually feel that with your hands.
Disadvantages. If the diaphragm is stuck or otherwise expands, breathing will become difficult. The diaphragm sometimes contracts involuntarily due to certain irritations. If air is inhaled at the times of contraction, the space between the vocal cords of the back of the throat closes suddenly, producing the noise we call hiccups.
I don't know. They just come on, and it's really embarrassing if I'm on the phone with a client and I have hiccups and I'm trying to muffle it. I think that the best way that I've been able to get rid of them is literally just stop breathing, which I know doesn't work for a lot of people, but that works for me.
Well, I don't know about all that, but why don't we take a look at what really happens when you get singulus, which is the medical term for hiccups. The part to blame is your diaphragm, the dome-shaped muscle at the bottom of your chest. All hiccups start here. The diaphragm almost always works perfectly. When you inhale, it pulls down to help pull air into your lungs. When you exhale, it pushes up to help push air out of the lungs. But sometimes the diaphragm becomes irritated. When this happens, it pulls down in a jerky way, which makes you suck air in through your throat suddenly. When the air rushing in hits your voice box, you're left with a big hiccup. Eating too quickly or too much food, too much spicy food, anxiety, being nervous, these can all cause irritation to the diaphragm and therefore start the hiccups.
Diseases: paralysis, herniation, phrenic nerve injury, and diaphragmatic ruptures.
A congenital diaphragmatic hernia is a birth defect in which an abnormal opening in a baby's diaphragm allows abdominal organs to move into the chest. The diaphragm is a large dome-shaped sheet of muscle that separates the chest from the abdomen. When the baby breathes in, the diaphragm and outer rib muscles contract, expanding the chest cavity. This expansion lowers the air pressure inside the chest, creating a pressure change that causes air to rush into the lungs. When the baby breathes out, the diaphragm relaxes and the inner rib muscles contract, reducing the size of the chest cavity. This reduced size increases the air pressure inside the chest, forcing air out of the lungs. For unknown reasons, the diaphragm in some babies doesn't develop completely before birth, resulting in an opening between the chest and abdomen. The most common location for this opening is on the left side of the diaphragm, near the back. The baby's abdominal organs can push through or herniate through this opening in the diaphragm and compress the lungs. As a result, the lungs do not develop fully, causing the baby to have significant trouble breathing right after birth.
Oh, it is all. Thank you.